Okay. Well, thank you for offering to tell us a little bit about your experience with chiropractic. What I'd like to ask you first, Melinda, is tell me just briefly about the problems that brought you here to Natural Health Family Chiropractic, and a little bit about what kind of treatments maybe you had tried in the past and how successful that was.
6 years ago, I was diagnosed with endometriosis. I've always had pelvic pain since I was 16, but I was diagnosed with endometriosis 6 years ago. And along with that, they gave me a diagnosis of a thyroid problem and also borderline diabetic, insulin resistant. And I've had 3 laparoscopy surgeries that they lasered out the endometriosis, which has caused a lot of scar tissue, and it hasn't stopped the endometriosis from growing.
Okay.
And also my 4th surgery was last summer, and they took my left ovary and did a uterine abrasion. And I found myself within 2 months in pain again. And my mom, who has been going to this chiropractic care, she had talked to you, Dr. Lindholm, and said that it might be helpful for me to come in because I had been on cancer medication to try to get rid of it. I've been on several other medications to treat the other problems that came with it, and I was just in pain again and taking Darvocet and Vicodin and Tramadol, and I was taking all kinds of narcotics basically, and I didn't want to take those, and I've been taking a birth control. Well, I started trying it to come to chiropractic care, and Dr. Lindholm described everything that what the nervous system does, and I stuck with it and did the plan that was suggested to me, and probably within a week I found a decrease in pain, probably I would say about 50%, and then after about 2 weeks about an 80% decrease in pain.
That's great.
Yeah, so this was like the only thing that has worked and to keep me from another surgery, because my other option is to just keep having surgeries to burn it out, or to have a whole hysterectomy, which I don't want to have done. So it's been frustrating, but this kind of gave me a little bit of hope.
Great.
So.
Well, it's really interesting that you, like a lot of our patients, were referred here by somebody else that had a positive experience. That's why I'm so glad that you're sharing with others, sharing your story with others, because a lot of people, may not be lucky enough to have a mom or a friend or a relative that's already a patient here that can tell them about chiropractic. So tell me now a little bit about, and you kind of touched on a little bit about your improvement, but tell me maybe in a broader sense, since starting chiropractic care here at Natural Health Family Chiropractic, how would you say your life has been impacted?
When I come here, I don't feel like I'm a patient necessarily. I feel like you have always you know who I am, and you knew what my goals were, and you worked with me, and not only did you fix the subluxations, but you would talk to me about diet and exercise, and that helped a lot. In fact, so much so that when I had my blood work recently done, I'm no longer insulin resistant, and my thyroid level was fine, although I still have to stay on the medication. But so I'm no longer borderline diabetic, and my pain comes less often. And so we work on the chiropractic care that way, like based on pain now. And at first, we were trying to kind of fix the issues with the subluxations and get me in a place where I can just come now and as maintenance, which is which is wonderful. So.
Right. And I have to say, from my perspective, that you have been an ideal patient to work with in that you've, followed my recommendations. Like you said, you followed our recommended course of treatment of the regular adjustments, but also, like I said, our approach is a very holistic, lifestyle-oriented approach with almost all of our patients, but especially with something more involved like endometriosis and the problems you had. So, but you took to heart the things that I recommended about improving your diet and exercising regularly, and that has made all the difference, I believe, in your response to care too. So.
And your holistic approach goes right in sync, parallel to what my OBGYN is doing with me. He's just more medicinal, and so it works so well together, because then I feel like I'm taking care of as a whole person, like my mental and emotional and physical and health-wise. I feel like I'm taken care of as a whole.
Great. This question might sound a little strange, but I'd like you to kind of answer this question for me. So the question is, here's what I think others should know about Dr. Lindholm specifically, and then about chiropractic care in general. You can be as brief or.
Well, my answer may be a little bit different too. Okay. But the first thing that concerned me when I came here was, how much was this going to cost? And what I realized, though, is because I have to go less often to my OBGYN, I'm actually spending less and gaining more physically and mentally and emotionally, and it's $37. $37, and I'm getting an adjustment done today, and I know that by this evening I will be 90% alleviated from the pain that I'm in right now. Yeah. And I'll have more energy, and I will be able to digest my food better today, so overall I will feel better. So it's like if you put a pros and cons list in front of your face and said, do I need chiropractic care or do I just keep on suffering? Mm-hmm. Let's see here now. The cons, hello, we need to get this fixed. Right. So to me, $37 to come in to get this, just a better frame of mind even, is worth it to me. And clearly, because I've been here for a year, so.
Yeah, and that's a good point. That's something that sometimes people don't bring up, but I feel, but it's good to hear you say it, that my patients realize that it's a good investment. We find, and I don't know if this happened with you, but we find with some of our patients that have a more involved problem like you, that maybe if they just stop taking one or two of their medications, not only does that help with fewer side effects and just fewer drugs, which is a good thing, but sometimes they save more money in the medication they are able to stop taking, especially if they're paying cash for it and it's not covered by insurance, that they end up money ahead over what they spend on chiropractic care. So,
well, you're absolutely right, because I don't have to take as much Vicodin and Darvocet, because I'm taking more fish oil and I'm taking more of the supplements that are natural that my body can use, and I don't have the side effects. And the same as with my daughter, who comes here as well, who's 10 years old, and she has chronic sinus infections, and I've had to take her about half the time to her physician because she's gone here, and so that's saved me money in the long run there.
Yeah.
So.
And that's awesome. That's our goal for one of our actual stated goals as a clinic is we want to not just help individual patients, but we want to help families. And a lot of times that's usually the way it works, is that, like you said, one person comes in, they tell somebody else about it, like in your case your mom told you, and then we end up treating you, your husband, your children, and the whole family unit. There's a dynamic too, that when you improve the whole family's health, it has a synergistic effect. So,
well, and we are supported with each other with the knowledge that you've given us about the food intake and the glycemic index levels and things of that nature, and how we need to take care of our bodies. So we all are in support of each other, because now you've got 3 generations of us.
Yeah, that's right.
So.
Well, and that's how we can affect the whole community, one family at a time. So I think actually the other 2 questions I was going to ask you just kind of answered, but maybe the last one maybe you could that I would ask is, what do you have any closing kind of comments, or what advice maybe would you offer to other patients that are striving for a wellness kind of a lifestyle for themselves or their family?
Well, you have to make that decision on your own. If somebody is forcing you to be in there, then you may not be motivated to do it. You have to decide and make a conscious decision that I want to change my life for the better. I want to be a successful person, because you will become successful if your emotions are right and your physical body is right, and could you imagine being pain-free? Could you imagine that satisfaction to get up in the morning and have that energy and feel like, okay, today I don't have to worry about this stuff? It really has an impact on who you are as a person and how you treat others throughout your day. And that's the whole point of life, is to just be successful and have a lot of fun.
Yeah, great. Well, that is so interesting that you put it that way, because I tell people, I think when you boil it down to the bare basics, that one of the benefits of seeing a chiropractor is that makes life more fun, because your body's working better. You can do the things you want to do.
Yes, okay, absolutely.
Great. All right. Well, thank you so much for sharing with us and with others today. Thank you.
Well, thank you for taking care of my family.
You're welcome.